Hello, everyone. Welcome to Lump Basics or Lump TCM 101. We are now on episode 58, and let's start with the first one. Let's welcome Sir Dino Pinheiro, Certified Associate Acupuncturist of Legazpi City. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with lump basics, the water element, yin and yang excess. As in the case of all excess symptoms, this would be an acute state with recent onset. An acute illness is a mixture of pathogenic and the anti-pathogenic factors between action and reaction. For instance, if there was an injury or inflammation, the yang would increase. A healthy yin would increase to fight the yang and to protect the body. The pain that the patient experiences in this situation would be both during activity and in rest. This would be an excess situation for both yin and yang for a short period of time. And then one of these two energies would win the battle and one of them would decrease. This then becomes the subacute state where the pain would show dominance of either yin or yang. If the patient was exposed to cold, this would cause yin excess, especially in the kidney or urinary bladder related meridians. A healthy yang in the kidney or bladder would increase to oppose the yin dominance. This would cause a stiff and incapacitating backache with yin and yang simultaneously in excess. This both in excess situation could be treated either by sedating only the causative factor, which would in turn bring the other down, or when it is not clear which increased first, then both could be sedated. Example, a patient has acute backache after cold exposure. He's stiff, it hurts to move and to be still. He's cold in the back and heat is comfortable, but it does not lessen the pain. So sa treatment, local hot needles, many, sedate kidney fibres, C-clef point used to sedate in acute states. You could add, when cause not clear, UB63 C-clef point sedation and UB40, the area distal point. Yin and yang deficiency. The two main differences between the excess and deficient states of both yin and yang are excess state is recent, acute, and deficient state is chronic over 6 months. In the excess state, both are simultaneously in excess, so you would see symptoms of damp or cold and heat, shivering, and fever, and child blame together. In deficiency, both are weak and cannot control the other, so one can rise at one time and the other can dominate another time. So here, the tower diagram, both are deficient. Then this is followed by increase in yang or increase in yin. This would mean that if the patient stands for 10 minutes, the pain will worsen. If he sits for 15 minutes, it is painful too. So he has to stand lying down for more than 2 hours. It's very painful. So he has to get up in the middle of the night and walk around and take painkillers before going to bed. But walking for any length of time makes the pain very bad, so he does not go out of the house. The back feels weak and stiff, and the pain could be sometimes dull and sometimes sharp, radiating. This is how the patient would describe the pain. The pain seems to be sometimes yang and sometimes yin dominant in character, and it has a chronic history. Sa treatment, use more local needles with superficial insertion at the early treatments and gradually increasing the depth in consecutive sessions. tonifying the yin and yang of meridian, first using mu and shu points only. In the third or fourth sessions, these could be substituted by tonification points of both yin and yang meridians. Use moxa with cigar, but only to mildly warm the area and not allowing skin color to change. Advise very moderate back and abdominal exercises while lying in bed. Clinical example, we have a male, 47 years old. This patient came to me, sabi ng author, with a constant low back of over 3 years duration. He always had a back problem, but in the last 3 years, it had worsened to the point that he had to stop working. He had been a plumber and was now a house husband. He has thin with a permanent look of agony on his face. He felt his back was very weak and vulnerable, and he had quite a few epidural injections in the pain clinic. With pain returning within days after some of this, he was afraid of surgery and was taking many pain medications and suffered abdominal pains due to this. Sabi ng author, I treated the patient with many local points, starting with shallow insertion and gradually increasing the depth of the needles. Ran 3, UB28, the mu and shu points of urinary bladder for 3 sessions, and later, kidney 7, UB67, tonification points, and UB40 as distal point. I also gave him point heart 9, small intestine 3, and PC6 as points against depression. The treatment was given twice weekly, and he came by taxi each time. Luxury he could ill afford, but he could not drive or use public transport because of the pain. There was no improvement at all in this time, and after 12 sessions, we decided to stop treatment. After 3 months, he phoned to tell me that the pain had started gradually diminishing and had completely gone. He was very pleased that we had continued the treatment sessions for the period he did. Even though there had been no improvement during the time, since then I have treated every one of my patients with chronic yin and yang deficiency backache for 12 sessions. Whether or not they improve during the treatment time, generally, the patient will not come for treatment if there is no improvement within 4 to 5 sessions. I tell them at the initial consultation that the pain relief could come after 12 sessions have been completed, so they may be willing to continue. It has been my experience that acute pains need frequent treatment sessions within a short span of time. 1 to 2 times daily at the start, then 3 sessions weekly until pain is 90% better, as excesses take a short time to be dispersed. Conversely, chronic cases require less frequent sessions and longer periods of treatment. Twice weekly at the beginning, after 50% improvement change to once weekly, stop gradually by increasing the intervals between the sessions. In every deficient states, maintain with once monthly session for a few months. Kidney opens to ear, sensitivity, hearing. Every element is associated with a sensory organ, and kidney opens to the ear. In the Western medicine context, this sounds quite illogical, but in TCM, kidney is related to physical activity, just as the heart is related to mental activity. And overtiring the body may result in tinnitus. Kidney relates to bones, and otosclerosis in the ear could cause conductive hearing loss, and cold exposure could cause middle ear infection. When children are born deaf, they are born with kidney yang and qi deficiency. Sensitivity to hearing is a young activity and function, and problems with hearing would be symptoms of kidney deficiency. If all sounds heard are low in volume, this would be nerve deafness if Chi deficiency symptom. This is either congenital or occurs in children with frequent ear infection causing glue ears, fluid in the middle ear, or in the elderly with weakening of the nervous system. But if there is a partial hearing loss, missing out certain frequencies of sound altogether, bone deafness, this is more likely to be a yin deficiency symptom. This occurs in adult life after chronic exposure to noise or in osteosclerosis. Thank you for your attention.
Thank you very much, Sir Dino. We proceed to wood element. We are still on the concept. The liver opens to the eye. We can see because the liver energy enters our eyes. So if our liver chi is weak or it cannot enter our eye, we will not be able to see. All problems with vision are primarily caused by imbalances of the liver, and other organs are associated with different aspects of the eyes, thereby affecting sight as well. Both short and long-sightedness are related to poor function of the eye muscles that operate the lenses and are yang deficient states of the liver. There seems to be more liver in long-sightedness than in short-sightedness. Patients with long-sightedness, or those who could see far, have problems reading in the evenings. They seem to need more light than others, whereas the amount of light does not seem to be an issue in short-sightedness or myopia. So here we could see the tower diagram that corresponds to short-sightedness or myopia. As you can see, the liver yang is deficient. With long-sightedness or hyperopia, the yin is in excess and the liver yang is deficient. Of course, short or long-sightedness could be a chronic problem in patients who have more recent disease states in the liver. Therefore, this should not be the only factor one should consider while making a diagnosis. The illustration of the eye shows the associations between other organs and the eyes, and we should bear in mind that the liver is always affected in eye problems. So let's start with the cornea. The cornea, sclera, and conjunctiva are like the skin of the eye. They are therefore associated with the lung. And dryness, astigmatism, and problems that are similar to dry skin, lung yin deficiency, or even liver yin deficiency. Conjunctivitis and itching of the eyes is common in hay fever. Symptoms associated with wind heat in the lung, similar changes of irritation, sweating, sneezing, and runny nose are present in the respiratory system as well. Now let's talk about the iris. So I hope you remember where the iris is located in our eye diagnosis. So actually the iris is the colored portion of the eye. This is a muscle that widens. So look at it as the shutter of the camera that widens and contracts to let light in or keep it out. So the iris, there's an opening there called the pupil, which widens to let the light in and which contracts to keep the light out. If the function of the iris is good, it will move quickly. So this will enable us to adjust quickly to changes in light. If functional chi is deficient, the iris reflex slows down and adaptation to light changes takes much longer. So a person is temporarily blinded when coming into a bright area, or takes much longer to see clearly when going into a dark room. Iritis is a young access of the liver and following recent recurrent inflammation, there could be yin deficiency and the iris becomes contracted and has difficulty expanding. The medial canthus is related to the heart. It is red and irritated in a young dominant state of the heart, the redness spreading to the white of the sclera. In yin states, it is so the medial canthus would be pale or grayish, and it has a sunken appearance. The pupil, the lens, and the vitreous body. These are governed by the kidneys. Cataract and turbidity of the vitreous body indicate concentration of fluid, a dryness of the kidney, and of course, liver yin. Glaucoma or increased eye pressure indicates stagnation of fluid. So there is yin stagnation in kidney and liver. The upper and lower eyelids are related to the spleen. When spleen function is deficient and it does not circulate fluid to the periphery, the patients have edema in the hands, feet, tongue, and in the eyelids. And in the case of gastritis or hyperacidity in the stomach, it is possible that the eyes have a red eyeliner type appearance. Thank you very much for your attention. Let us welcome Ma'am Lynn Galarita of Quezon City for diseases of the wood element. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. Today we're on our fourth installment on the diseases of wood element. We're still discussing or sharing with you some clinical examples of those patients presenting with headache. So the first patient is a female, 58 years old. Her headache pattern is so common that the doctor thinks we can see this kind of patient every day. For those of us who live in cities with much pollution or in the countryside full of pollen and near farmlands sprayed with many chemicals, our nose and sinuses are always irritated by these factors. Many patients suffer from chronic sinus problems and some are not even aware of this fact. The above patient came to the doctor with frontal headache on the forehead from hairline down to nearly half the face, including the area of the maxillary sinus. She had pain on both temples extending to the ears, but the eyes did not hurt. It was a dull, heavy headache. She woke up with this headache every morning and it made her dull and irritable. She was never a morning person because of these headaches. Painkillers did not help and she had no appetite in the mornings. She started feeling better during the day and was well around the noon. The headache would be worse if she stayed in bed longer, and then it also took longer to improve. The patient was pale with a puffy appearance of the face and she never smiled. Her typical response to any question was a no first, and then she would consider it. It was difficult to diagnose the cause of her headache as she did not have any stomach problems or large intestine symptoms. The headache occupied a large area of the face, and she claimed she had no nose or sinus problems either. Her teeth were okay too. She was given some local and distal points, but she continued to have daily headaches and her bad mood persisted, not making it easier for both the doctor and her. Okay. The doctor noticed earlier that she had a habit of sniffing very often. This was more noticeable in mornings and not too bad in their evening sessions. The doctor preferred to see her in the evenings when her headaches were better. She once was asked about it, and she said that she did not sniff. When all other possibilities of diagnosis failed, the doctor decided to pursue the point about the sniff. Even though she had no history of nose and sinus problems, she had pain in the areas around both frontal and maxillary sinuses. Moreover, she had a damp pain on the face, as dampness settles on the head and face when in bed and drains downwards when upright. It is possible that her sinuses were affected by chronic damp stagnation. The treatment given was based on the findings or the following points. The doctor used local points, bladder 2, stomach 3, given in the direction of LI20, the extra point number 2 or the Taiyang, and LI4 was also added, and then symptomatic points for headache, gallbladder 20, and stomach 40 for circulating dampness. Energy balancing points were also added. That's bladder 13, the backshoe point of the lung to improve lung function, and LI6, the loop connecting point of the lung, which tonifies the yang and sedates the yin. And the patient was asked to avoid refined sweets and fatty milk products. She had 14 sessions in all. The first week, she was treated 4 times. The second week, it was 3 times, and so on. She was also given some heart yang tonification later. That's bladder 15 and SI7. The doctor thought or argued that the lung could use some help from its neighbor. She first admitted to feeling better only after 2 weeks of treatment. But the patient knew she was better. If not, she would not have continued to come. And she had stopped sniffing. When the doctor commented on it, she told that she had never sniffed. May in denial tong pasyenteng to. Okay. Here we have another clinical example, still a female. She's 78 years old. This patient was the first among the many patients of this doctor in his practice in Birmingham. She was a very bad case, had a very bad case of rheumatoid arthritis and was wheelchair bound. She was on a small but regular dose of prednisolone, less than 5 milligrams daily for over 2 years. She depended on her elderly husband to bring her for treatment. Most of her joints were quite stiff with little mobility, but she was cheerful with a red face and chatted easily. The muscles on her arms or legs were quite atrophied, and she had little movement in her fingers. The problem she came with was that her temporomandibular joints were very tense, and she could hardly open her mouth to chew. While eating her food, she experienced severe pain in both jaws and also in her head. This pain could last for days, thus making it impossible to eat. The headaches occurred in both sides of her head, one side more than the other, on the temples and the parietal areas. When examined, she had much tenderness in these areas. She had had acupuncture before at the hospital pain clinic, which had involved treating mainly the local points of pain. She had felt no improvement and had decided to try private treatment, even though she could ill afford it. She was examined thoroughly. The only marked imbalance that the doctor could notice was the difference between her upper and lower body. Her face was red and her head was hot. She talked a lot and was in a good mood. Her lower body was very cold. Her ankles had cold edema and her skin was very thin. On the whole, the doctor saw that all her blood and energy was in the upper body, leaving the lower part very deficient and cold. All the treatment she had had previously concentrated on the part of her body that had the heat and energy. So this time the doctor decided to concentrate on the part which needed the heat and energy, thinking that if the blood and energy could flow to the legs, then they had to come from the upper body, thus reducing heat and energy there. Okay. So for the treatment given, the following points were used. Kidney 3, which is the earth point of the kidney, and the grandmother point, which tonifies the young. Bladder 58, the Luo connecting point, which tonifies yang and sedates yin. Stomach 40, the symptomatic point for dampness. Kidney 1, to warm the feet. Only moxa was used here. It's very painful when needled. Ren 12, 17, and 24 to ascend the yin to the upper body. And lung 7, the confluent point of Ren channel to increase general yin. And a few tender points on the head. These areas change each time. So, kailangang ipalpate para makita kung saan yung mga tender points. Okay? And finally, gallbladder 20, the symptomatic point for headache. Initially, she was treated twice a week. Soon, treatment was increased at the interval between sessions, and the doctors saw her once in 1 or 2 months. She was fine between treatments and could chew her food without pain. But they could not stop the treatment, so she was treated for over 5 years until she recently passed away after a stroke. As you can see, every headache had a story behind it. If we take care to listen and put 2 and 2 together, we can diagnose the cause easily, then proceed to correct the imbalance. When the diagnosis is not clear, one cannot treat with local, distal, and symptomatic points only for a few times until we are better able to understand the imbalance. So that's all for today. Thank you for listening.
Thank you very much, Ma'am Lynn. Let's call Sir Dino Pinheiro once again for metal element concept. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we go to the metal element, the concept. Associated flavor, spicy. A spicy meal would make the nose run and the skin sweat, and the next day irritated the bowels as well. A patient suffering from colitis or eczema will definitely feel worse after eating spicy food. Spicy food increases the yang of the lungs and large intestine. Why is it then that people living in the tropical countries eat more spicy foods than those living in colder climates? Spicy food, namely chili, pepper, mustard, horseradish, garlic, ginger, onion, leeks, and other foods that burn in the mouth irritate us all the way when one eats them. But they also increases the elimination function of the lung and large intestine, which helps to cool the body. For instance, it would be very good to give hot temperature ginger soup to a patient with fever. It causes sweating and the fever would decrease. But spicy food worsens illness with excessive elimination already, like diarrhea, excessive sweating, to name a few. Patients with lung yang deficiency generally crave spicy food. The amount of spice they gave is more than usual that is eaten in their country. The yin or yang nature of any flavor will change when it is diluted with another flavor. When spice is mixed with sweet or milk, cream, and damp producing food flavors, it can increase the dampness in the lungs and skin. White rice with coconut milk curry is an example of this kind of food. When it is mixed with bitter flavor, it increases the heat in the lung and skin, like barbecue spiced meat. Energy-giving color, white. White is the color of limitless space. If you wish to create an illusion that a little room is in fact a large one, You only need to decorate the room in white from top to bottom. In a large space, we can breathe more easily. In a small space, one can feel claustrophobic and suffer from tight breathing. When a patient has a strong liking for bright white, it suggests a young deficiency. If the liking is for an off-white color, a yin deficiency may be present. White is a color that reflects everything that falls on it. Houses in tropical climates have white outer walls as they reflect all the sunlight and the interior does not get too hot. As healthcare workers, we wear white overall in order to protect ourselves from the harmful energies of the sick people that we work with all day. The white clothes strengthens our outer shield, thus enabling us to reflect the bad energies away. White also depicts pureness and cleanliness. Some people find it difficult to be in confined space, yet some feel safe within four walls. Some people like to be out in the open, others feel afraid they may get lost. Next is claustrophobia. Claustrophobia is a fear of closed spaces, such as lifts or traffic jams. Throughout our lives, we grow out of one confined environment into another. At first, it is only the child, mom, and dad, then the extended family, the nursery school, later the primary school, the college, university, student hostel, workplace, another city, another country, and so on. Every change is both difficult and exciting, and there is a process of adaptation. We like to be independent and not have to rely on anyone. But we also need to belong somewhere, identify ourselves with some group. The group with which we identify ourselves may get larger, but a strong sense of belonging to some group is necessary. Our skin covers us all around and confines us in a way. When we want to be fiercely independent, we dislike being confined. We feel the fear of being confined into a relationship or in a workplace or in a situation. There is a strong dislike for figures of authority. Confinement can cause panic, tight breathing, and sweating as symptoms. What is it that expands? The young, of course. When is the young more likely to expand? This would be a yin deficiency situation. So we have here a tower diagram of a lung. There is an excess of yang and deficient yin. The lung yang increases from time to time, causing the energy to expand. Try to get out of the skin. So sa treatment, we use lung 1, the mu front point, lung 7, the loop point, tonifies yin and sedates the yang. Ren 17, influential point for respiratory organs. Small intestine 8 and triple warmer 10, sedate if patient is often hot and restless. Sedation of LI4 when fear is acute. Next, we have the agoraphobia. Agoraphobia is a morbid dread of open spaces, especially with many people around. There are some people who prefer to be within a small known family or workstation with someone telling them what to do, someone else taking responsibility, and with no surprises and no challenges. Take them out of this known safe situation and into a larger place with responsibility, and they will feel lost and panicky. It can make them faint, their legs will not move, they cannot function and seem paralyzed. Such people need to have a very thick protective wall around them so that they can feel secure. It is a sign of lung yang and qi deficiency and need a lot of reassurance and a person to guide them. Sa treatment, we use LI11 tonification point, indirect tonification of lung yang. Lung 11, the far point, will increase lung yang if the small intestine has sufficient yang. UB13, the backshoe point of lung, and the bright white color around them to broaden their horizon. Thank you for listening.
Thank you very much, Sir Dino. We call once again Ma'am Lynn Galarita for the next topic, the Jing. Good afternoon, Ma'am Lynn. Okay, we will take over for Ma'am Lynn. The source of Jing. Jing is the source of life derived from parents, supplemented by post-heaven Qi. It is the basis of all organic life, fluid-like, and the blueprint for mental and body development. And the Jing is mainly stored in the kidneys. The Jing is responsible for growth, reproduction, and development. It is very important for development of a person through life, and it's responsible for the growth of bones, teeth, and hair. The Jing is also important for the brain and sexual reproduction, fertility in both men and women. Okay, the Jing also promotes the kidney Qi. Kidney Qi is the root of all Qi in the body. If deficient, then you will see weakness in the whole body. Producing marrow. The marrow also includes the brain and spinal cord. The Jing determines our constitution. It works with Wei Qi to help protect the body. If the Jing is weak, then you will see the illness or chronic infections. Now let's talk about the formation of Jing. Pre-heaven or prenatal substance. This is the one received from the parents. The quality and quantity of Jing is determined at birth. We get this from both parents at conception and while we are in the womb. Then post-heaven, a postnatal substance created by food, air, and lifestyle. Now let's talk about disharmonies of the Jing. First is retarded development. Weak Jing in children may lead to poor bone development, slow learning, or poor concentration. As we get older, the weak Jing causes premature graying of the hair, balding, deafness, osteoporosis, senility, and unclear thinking. Kidney disorders. Because of the relationship with the kidneys, if the Jing is weak, we will have poor memory, dizziness, poor concentration, impotence, low back pain, and tinnitus. Constitutional weakness. This leads to chronic problems like allergies, autoimmune disorders, and Wei Qi deficiency. When we have no Jing, we die. Now let's talk about the Shen, or the mind. The Shen is the spirit of the person, the ability to think, and the force of human personality. It is often described as the mind to form ideas and have the desire to live. The state of Shen is observed in the eyes. Eyes with glitter and spark indicate a healthy, good spirit. If the Shen is in disharmony, the eyes are dull without glitter. It shows a disturbed spirit. A person might be slow, forgetful, suffer from insomnia, not clear thinking. If there is an extreme Shen disharmony, this can lead to violent madness and unconsciousness. Now let's talk about the three treasures, the Jing, the Qi, and the Shen. Jing is responsible for the developmental process of the body. Qi is the next stage, responsible for the more immediate life of the body. And Shen is the most refined level, responsible for human consciousness. Thank you, everyone, for listening. Let's call once again Sir Dino Pinheiro for the water element, still on the concept. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we go to the water element, post-menopausal syndrome. Nowadays, women lead very busy lives in comparison with the past. They work in a very demanding jobs as well as running a household with a husband and children. When older, they try to continue working, looking after their older children and grandchildren, running two families instead of one. Sabi ng author, I admire them for their hard work and the love they have for their families. But many of them come to me in frustration and anger that they cannot work as much as they could before their menopause. I do not believe a tablet or skin patch will, but put them right instantly, but balancing their energies in natural ways will help enormously and without side effects. Except in the case of women who are extremely malnourished and dehydrated, or those who have had an oophorectomy, the body will secrete the necessary hormones for our well-being. But when we take a pill to put it right, then we are inhibiting the body's coping mechanism. When a woman is of a certain age, it is a common regard all her problems as menopausal. If we take the trouble to question her more, we will find that many of these symptoms would have been bothering her for much longer. Excuse me. It is important for the patient and doctor to realize that menopause is not a medical condition, but a natural event, and that given the chance, the body will cope with it quite well. The main symptoms of menopause seems to be dryness and heat. The dryness is generalized, affecting the skin, head hair, nails, vagina, and the urethra. The heat seems to come in flashes and mainly to the upper part of the body, with sweating attacks. As the menopause begins with a decline in the female hormones, it is evident that the patient becomes yin deficient, which makes her more dry in the lower part of the body where the reproductive system lies. When the kidneys become yin deficient, they are in a yang dominant state, and the yang can rise higher from time to time. Heat, wherever it originates from, has a tendency to rise upward to the upper warmer, increasing the heat in the heart and lung, hence the hot flashes and the sweating. Night sweating is a special symptom of yin deficiency. It is normal to sweat when we feel hot, but we also need water in order to sweat. When the yin is deficient, there is less water for sweating. The yin would be filled in the yin situation during night and during sleep, when there is also water for sweat. This is why nocturnal sweating is a symptom of yin deficiency. So sa treatment for post-menopausal syndrome is to tonify kidney yin, descend the ascending heat back to the lower warmer, and to treat the other problems symptomatically. It is also necessary to give dietary advice to patients. So we use kidney 4, which is the Lu point, tonifies yin and sedates yang. UB64, sedation, which is the U1 source point. This sedates the yang. This is optional and can be used if the heat symptoms are very strong. Spleen 6, descending technique. Ren 3, the move front of urinary bladder, tonifies yin. So we have here the needles to unblock scar, the kidney meridians, Ren meridians, and the location of the scar. If this woman have a lower abdominal scar due to cesarean section, hysterectomy, or other surgery in the past, it is important to unblock the meridians that had been blocked. The Ren and the kidney meridian should be unblocked using 2 needles, 1 on either side of the scar, 6 in all for 3 meridians, and 1 needle on point Ren 24 to bring the yin to the head. Symptomatic points for the poor sleep, we use Do 20, good night, amnian, extra point, night sweat, lung 7, Lu point, closes the skin pores, anxiety, tachycardia, PC 6, Ren 14, heart 5. Advice against heat: avoid coffee, red meat, spicy food, take midday rest. Against dryness, drink plenty of water, eat watery fruits, and clear soups, swim or bath, and then sleep. Kidney governs water metabolism. At all times, the quantity of water in our body is equal to our kidney yin. Kidney yang affects the distribution and elimination of this water. Urination is an elimination of excess water and toxins from the body. The kidney function, Qi, is to decide correctly how much water should be stored in the body and how much should be eliminated. If there is excessive urination, it is not necessarily a sign of excellent function of the kidneys. Little concentrated urine is also not always a symptom of poor function of the kidneys. The correct function of the kidneys depend on the quantity of water in the body. For instance, if the weather turns cold and the kidney yin increases, if the function is good, the kidney will send out more water, more urine. If there is much water in the body and the kidney function is poor, there would be less urination and water retention. If the body is dry, the healthy kidney will try to hold on to the water and urine will be infrequent and concentrated. This may cause kidney stones and consequent kidney colic with rising yang and hematuria. And if the body is dry and there is increased thirst, the patient urinates excessively every time he or she has a drink. It indicates poor function of the kidney. So, sa kidney function, the first tower diagram, excess ang yin, normal ang qi, yin excess and normal function, frequent and excessive urination, no dryness or thirst. Next is excess ang yin, deficient ang qi. Yin excess, less urine output, poor function with water retention, and edema. Next is deficient ang yin, normal ang kidney qi, general dryness with good function, little urine, 2 to 3 times a day, concentrated, can get kidney stones and colic. And the last tower diagram, both are deficient, general dryness, excessive thirst, and frequent excessive urination cannot retain water. The symptoms of the urinary bladder are problems with holding and releasing urine. The yin of the bladder is its capacity and the quantity of urine it holds. The function is to decide when to open and when to close. For instance, opening the urethral sphincter before the person gets to a toilet and not to be able to open it after getting to the toilet, what shows poor function or qi deficiency. To pass urine with a poor stream with some amount left in the bladder after urination and dribbling after urination is completed after qi deficiency symptoms as well. Urgency, increased frequency when nervous, and burning urination are symptoms of excessive yang or heat. Cystitis, prostatitis are symptoms of yang excess. Okay, we go to acute cystitis sa urinary bladder. The first tower diagram, yin and yang are both excess. Then there is excess in blood and excess in yang and deficient in qi. In the acute phase, there is a heat and inflammation with stagnation of thick fluid. When subacute, this harmful yang affects the functional qi of the urinary bladder. The treatment should eliminate and cool the heat while assisting the functional qi. So we use the points, REN3, the move point, cools and calms the organ. Spleen 6, the area distal point for lower abdomen. UB63, sedation. The C-cleft point sedates excess during an acute situation. UB28, the bleeding cup, eliminates heat from internal organ. Sa ear, we use the urinary bladder, urethra, adrenal gland for inflammation, and Shenmen for pain and tranquilization. Drink water, keep feet and lower part of the body warm, and rest. In the acute phase, 1 to 2 sessions of treatment per day. Symptoms should improve within 1 to 2 days, or antibiotics should be given. Thank you for your attention.
Thank you very much, Sir Dino. Let's call Ma'am Lynn Galarito once again for the meridian theory. Good afternoon, Ma'am Lynn. Okay, we will continue with the Ren meridian. Ren 8 is located in the center of the umbilicus. So Ren 8 is located at the navel. This point is forbidden to needle, but can be used with moxa in the case of malabsorption diarrhea or flaccid paralysis of the lower limbs. The navel is filled with sea salt. A thin slice of ginger is placed on it and loose moxa on the ginger. The moxa is slit in several points and left to burn slowly. Remove the ginger slice when the heat is uncomfortable for the patient. Ren 12 is located on the anterior midline, fourth sun superior to the umbilicus or fourth sun inferior to the sternocostal angle. Ren 12 is the front mu point of the stomach and the influential point of the hollow organs. Ren 10, Ren 12, and Ren 13, the Shangwan, Zhongwan, and Xiaowan have symbolic names: upper bowl, middle bowl, and lower bowl. They symbolize the stomach as having many lobes. So there is one upper bowl and middle and so on. These 3 points are actually used to nourish the 3 warmers as well as tonify the yin of the pylorus, stomach, and the duodenum. Thus, the upper, middle, and lower parts of the stomach itself. Ren 14 is located on the anterior midline, tooth zone inferior to the sternocostal angle, or 6th zone superior to the umbilicus. Ren 14 is the front mu point of the heart and a very good point to tonify heart yin, improving its blood nourishing, memory holding capacity. Ren 14 is also used against anxiety, panic attacks, and tachycardia very successfully. It is needled at an angle towards the xiphoid. So here you could see the points that we mentioned. We have CV3, CV12, and CV14. Ren 15 is located on the anterior midline, 1 zone inferior to the sternocostal angle, or 7th zone superior to the umbilicus. Ren 15 is the luo connecting point of the meridian, connects to the Du meridian, and increases the yin of Ren meridian. Ren 17 is located on the anterior midline on the level of the 4th intercostal space. Ren 17 is the front mu point of the pericardium and the influential point of respiratory organs. Ren 17 is a dangerous point and should be given subcutaneously with a needle inserted for a distance of 1 to 2 cms. The direction of insertion should be decided beforehand. As with the direction of Ren meridian, it would tonify the yin, and against the direction, it would sedate the yin in the respiratory system. Ren 22 is located 0.5 zone superior to the sternum in the center of the suprasternal fossa. Ren 22 is a symptomatic point for cough and asthma. It is quite sufficient to needle this point only 2 to 3 mm deep. Massaging this point is also very useful when the patient has a fit of coughing. So here you have the locations of the the points that we mentioned, CV15, CV22, and CV17. REN23 is located on the anterior midline, superior to the upper border of the hyoid bone. REN23 is a local point for the larynx and the tongue, and often used in hoarse voice and stammering patients. The needling should be perpendicular, with the needle pointing towards point 220. It is best if the patient sits for this needle and keeps the head straight without tilting. Once the needle is in, that's about 1 to 1.5 centimeters, please check to see if the needle moves when the patient swallows. If it does, the needle should be pulled to a position where this does not happen anymore. REN24 is located on the anterior midline, below the lower lip, in the mentolabial groove. REN24 is the last point of the meridian. This is used to bring yin from the REN meridian to the face. If a patient seems to hold more yin in the lower body, but the upper body is hot or dry. So we have here the location of REN23 and REN24. Thank you very much for your attention. Let's now go to the last topic for this afternoon, chronic fatigue syndrome. We shall continue with our discussion of INFIRE. To recap, we'll have the clinical manifestations of INFIRE: feeling of heat in the face, red face, mouth ulcers, occasionally low-grade fever, dizziness, weak voice, depression, muscle weakness, exhaustion, feeling cold in general, loose stools, cold feet, spontaneous sweating, shortness of breath, pale tongue, and weak pulse. This condition of INFIRE and feeling of heat deriving from qi and blood deficiency is very common nowadays. And this is frequently seen in chronic cases of chronic fatigue syndrome and other modern autoimmune diseases like lupus or rheumatoid arthritis. As for CFS, INFIRE is a condition characterized by fullness and emptiness. There is fullness as there is dampness obstructing the middle and lower burner, and this dampness is often a residual pathogenic factor. Besides that, INFIRE itself is also a full condition. There is an emptiness as there is a deficiency of the original qi and of the stomach and spleen. If a patient has symptoms of heat that cannot be explained as full or empty heat. In addition, if there are some contradictory cold feelings, this is most probably due to INFIRE. So clinical note, including the clinical tip for INFIRE. Acupuncture treatment. We tonify the yuan qi. So we use REN4, tonify the stomach and spleen. So REN12, bladder 20, stomach 36. We lift the qi. So we use DO20 and REN6. Resolve dampness, REN9, REN5, bladder 22, and spleen 9. And acupuncture treatment of INFIRE emotional disturbance. We tonify the yuan qi, so that's REN4, tonify and raise spleen qi, REN12, REN6, stomach 36, DO20. We calm the shen and make the heat descend, DO24, DO19, REN15, and heart 5. Clear heat upwards and subdue minister fire, pericardium 8, pericardium 7. Regulate the triple burner 6, and triple burner 5. Thank you very much for joining us, and we hope that you join us again next time. Thank you.